Our time of standing pat and putting off unpleasant decisions, that time has surely passed. There is work to be done. Raise healthcare's quality and lower its costs. All this we can do. All this we will do. There are some who question the scale of our ambitions, who suggest that our system cannot tolerate too many big plans. Their memories are short. They have forgotten what this country has already done. A clear consensus that the need for healthcare reform is here and now. This isn't a Harry and Louise moment. It's a Thelma and Louise moment. We're in the car headed towards a cliff and we must act. Now, I just want to be clear, if you actually saw the movie, they did drive over the cliff. So, just want to be clear, that's not our intention here. The time is right for action now. Now is exactly the time. What better time than now? We've got to get this done. We've got to get it done this year. We've got to get it done this year, both in the House and in the Senate. And we don't have any excuses. The stars are aligned. The time is now. Fixing what's wrong with our healthcare system is no longer a luxury we hope to achieve. It's a necessity we cannot postpone any longer. It's time to deliver. We have finally decided to fix what's broken about healthcare in America. Right now, at this moment. I don't want to accept no for an answer. We need to get this done. Now's the time to do it. And that's why we're going to get it done. Healthcare reform this year. There's scars left over from past efforts at reform. Despite this long history of failure, I'm standing here because I think we're in a different time.
Do you still expect to get health care by the end of the year?
Yes.
Absolutely.
Absolutely.
If you don't, is it over for 4 years?
We're going to get it done. So I won't engage in hypotheticals in which we don't. It's going to get done because the American people understand it has to get done.
Can we support this? Are we for this? Are we certain that we'll have the care we need? Are we certain that this country can pay for it?
The answers are yes to all of that. This is going to happen. I just want to be clear. We are going to get this done. We need to buck up people a little bit here. That's what nurses do all the time. They buck up patients. It's time for us to buck up. We've got to get this done. I'm confident it's going to get done. Those who are betting against this happening this year are badly mistaken. We are going to get this done. We will reform health care. It will happen this year. This is going to happen. Let's pass reform by the end of this year. We're going to get the job done. That's the work we've come here to do, and I look forward to getting the job done. They're counting on us to get this done. We will pass reform, and we will do it this year. We're trying to get this done. We're going to make it happen. We are going to fix it when we pass health insurance reform this year. When we pass health insurance reform, this year. We are going to get this done this year. The debate's been good, but every debate at some point comes to an end. At some point, it's time to act. Ohio, it's time to act and get this thing done. Pass health insurance reform now, this year. We do intend to get something done this year. The time for bickering is over. The time for games has passed. Now is the season for action. Now is the time to deliver on health care. Now is the time to deliver on health care. I think this is the year we're going to get health care done.
Do you have enough votes?
We will have enough votes to pass not just any health care bill, but a good health care bill. We have to make this happen. I'm confident that in the end we're going to get this done. I'm confident we are going to get health reform passed this year. We're going to get it done. We're going to get it done. We are going to pass health care reform by the end of this year. We're going to get health care done this year. I don't quit. We get this stuff done. We keep on going until we get it done. We're going to get this done. We're going to fight for it. This is our moment to deliver. I urge members of Congress, rise to this moment. Vote yes for health insurance reform for America. Thanks. Historic vote the House took last night on health insurance reform. Now it falls on the United States Senate to bring this effort to the finish line. I'm absolutely confident that they will. I remain confident that we are going to get this done. Absolutely confident that we're going to get that done. I want to thank all of you for sticking with it, for all those late nights, all the long weekends. This is well worth all of our efforts. We are on the precipice of an achievement that's eluded Congresses and presidents for generations. I am absolutely confident this is going to pass. Feeling cautiously optimistic. We can get this done now. For the first time, there is a clear majority in the Senate that's willing to stand up to the insurance lobby and embrace lasting health insurance reforms that have eluded us for generations. Let's bring this long and vigorous debate to an end. With passage of reform bills in both the House and the Senate, we are now incredibly close to making health insurance reform a reality in this country. Our challenge then is to finish the job. Happy New Year. We are on the verge of passing health insurance reform. Today, we are on the doorstep of accomplishing something, and that is reforming health care and health insurance here in America.
You made that speech in August.
Well, one of the things that I've learned in Washington is you have to repeat yourself a lot. Get that done.